Hello, everybody. Today, I want to start talking about two very important concepts in medicine. One of them is allergic reactions, and another is diabetes. Okay. Who's heard of that? Allergic reactions and diabetes. I want to show you how, if you know big patterns in medicine, you're going to be able to know so much. See, the problem in medicine is most people just memorize all these little random facts. You're trying to memorize diseases based on, like, what did my teacher tell me way back when? What did I read out of some book somewhere? Well, I want you to actually know this stuff for yourself. So let's get right into it. So the first thing that we're going to talk about is allergic reactions. Let's pop that up on the screen. So we're going to talk about allergic reactions, okay? So the first thing I want to show you is when it comes to medicine, there are 5 levels of learning. Let's just review this really quickly. You've probably heard me go over this before. There are 5 levels. How many levels? Talk back to me. That's right. There are 5 levels of learning. The first level is where you know just the what. So I'll say, like, what is an allergic reaction? And you'll give me an answer. But that's not really good enough, right? Because anybody can memorize that. But then level two is where you say, okay, well, what do the protocols say do about it? So, for instance, let's say somebody's having an allergic reaction, and you may say, oh, I know the protocols say that we're going to give them epi, we're going to give them Benadryl, we're going to give them Medrol, maybe a dual nab, and all of that. But you're just memorizing that. Do you actually know it? Level three is where the magic happens, and this is where you know the how and the why. Okay, these are going to be the two most important words that you ever ask in medicine. How does this happen? Why does this happen? Tell me more. Okay, number four, level four knowledge is where you're able to apply something. You're able to take a concept and then be able to apply it all over the body. So, for instance, you're going to see how I take the concept of an allergic reaction or diabetes, and we're going to learn a lot of stuff in that one disorder, and then we're going to be able to apply it to other things in medicine. Okay. And then level five is the level we all want to get to. This is where we achieve mastery. Okay. So let's just move that out of the way for a moment because we're going to come back. We're going to reference that a whole lot of times. So there are 5 levels of knowledge. Level one is where you know the what. Level two is where you know what do the protocols say do about it. Level three is where you ask the two magic questions. And what are they again? They are going to be how and why. Level four is where you take that concept and apply it to something else. And then level five is where you go into mastery. Okay, let's get right into allergic reaction. So, what is it? An allergic reaction is where your body senses that there's some kind of foreign substance inside of you that it doesn't recognize, and it goes crazy. It goes a little overboard. So, this is the way it works. Let's say you get exposed to something, and we're going to call that, let's say, generally speaking, you get exposed to some pathogen. Now, path, let's break these words down. Path means disease, and a pathogen is some organism or some foreign substance that kind of causes a disease. When we're talking about allergic reactions, that pathogen has a name called an allergen. Okay, so it's something that induces or causes an allergic reaction. So let's say you get exposed to some type of allergen. That allergen could be, let's say, a peanut. It could be eggs. It could be shellfish, strawberries. It could be bees, wasps, ants, other insects. The allergen could be, for instance, this allergen instead of peanuts, it could be medications. What are some common medications that people are allergic to? Let's say penicillin, let's say sulfa drugs, things like that. It could be grasses, it could be pollen. There are so many allergens, but it's going to be the same kind of story. The only difference is your body will make specific chemicals to target that specific allergen. But let me give you kind of the general idea. So, the very first time that you get exposed to something, do you know what happens? So, the very first time you get exposed to, let's say, a peanut, what happens? Absolutely nothing. Now, why is that? The reason nothing happens after that first exposure is your body says, I don't know what to do with this. This doesn't seem like me. Your body is like, that's not like us. They not like us. But your body doesn't exactly know what is it supposed to do with it. Okay. So let me just break it down and just kind of follow me step by step. So you get exposed to this peanut. Your body says, wait a minute, I don't like this guy. It doesn't seem like it's supposed to be here. So here's what I'm going to do. We're going to start rallying the troops. We're going to go ahead and build the army so that the next time this comes along, we know how to handle it. So this is what happens. Your body goes through what's called the sensitization phase. So what's that word? Sensitization. Okay. What does that mean? It basically means your body becomes sensitized to it. Now, what are we saying here? So during this sensitization phase, your body says, hey, all right, here's what I need you to do. B cells, all right, B cells, I need you to go ahead and start making some antibodies. So, what are those B cells going to make? B cells are going to make something called antibodies. Now, when it comes to antibodies, what are antibodies? Basically, they're a protein that is involved in the immune response. Now, when it comes to antibodies, there are 5 types of antibodies. How many types? That's right, there are 5 types of antibodies. They have this special fancy name called an immunoglobulin. 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 Basically, that's a type of protein. There are 5 types of these antibodies, and they are known as Ig for immunoglobulin. So Ig, there's an IgA, or let's do it in a different order. The way I remember this is I say, let me put you on game. So there's an IgG, there's an IgA, an IgM, an IgE, and an IgD. Okay? So there are 5 types of immunoglobulins. Now, the one specifically involved in allergic reactions, oh, sorry about that. Hang on just a second. All right, bear with me. So, the one specifically involved in allergic reactions is going to be this one right here, and that's going to be IgE. The main antibody that's involved in allergic reactions is going to be IgE. Okay. So here's what your body does is it says, hey, we need some IgE. IgE, go ahead. We need you guys to get made so that we can deal with this peanut or whatever the allergen is the next time around. So what happens is your body starts making more and more of these antibodies. For instance, in this case, it's going to be IgE. And those IgEs will start to come together. So for instance, this is what happens. So we're going to take this IgE, let's make some more, then let's make some more. And your body says, hey, we're going to take these IgEs and we're going to link them up together. So here, let's link these up together. Okay. So when these IgEs link, we call that cross linking. So this step right here that I just drew, that's cross linking. Now, what happens is this IgE, this group of antibodies that has come together and cross-linked, they've linked up together. Now they're buddies, right? Now we have a whole troop of these. They go and they activate these things called, they're going to bind to something called a mast cell, and they're also going to bind to something called a basophil. Okay? Both of these cell types are involved in the immune system, but the difference is basically where they're located. So mast cells are primarily found in the tissues, and then basophils are primarily found in the blood. But they both do a similar thing. The main difference is where they're located. So that's that first step called sensitization. That's where the antibodies are made. So the B cells make the antibodies. The antibodies like IgE, they come together, they cross-link, and then they bind to the basophils and mast cells. But that's all that happens the first time around. At this stage, nothing else happens. However, your body has already started kind of rallying the troops. And so now the next time you get exposed to the allergen, let's say the next time you eat a peanut, it enters your body, or any other allergen, shellfish, eggs, penicillin sulfur, whatever the allergen is, the next time you eat it, your body says, all right, we got the troops ready. We've already started deploying some people to the area. So the next time the bad guy comes, we know how to take him out. We're ready, okay? We're not starting at ground zero. We've already kind of laid the foundation. So let's show you what happens next. First step of an allergic reaction is sensitization, and then the next phase of an allergic reaction is what's called activation. So now in activation, in that step, let's see, in the activation step, can everybody see that? Yep. So in the activation step, what happens now is when that allergen comes along, that allergen is going to bind to these antibodies that are already bound to the basophils and mast cells. So now here's our peanut. it comes and it joins up with this whole other cluster. Now, what's going to happen is these mast cells, so these mast cells and these basophils, they contain these different granules inside of them. So, for instance, the mast cell has one granule, then it has a different kind of granule. So let's give these some names. So, for instance, one of them is called a histamine. The other is called a leukotriene. So let's write that down. So we have, for instance, histamine, and then we also have something called leukotriene. Okay. Now, when those things go out to the tissues or into the blood. So if it's a mast cell and it activates the tissues, it's going to cause a reaction in the tissues. But let's say it's a basophil and it goes out into the blood, it's going to cause things to happen in the blood. So let me show you what happens next. So let's say here's a patient. Okay. In the tissues, for instance, let's say all over the whole body, what do you have? What organ is over the entire body? That's right, it's going to be skin. Well, in the skin, we have local reactions. So local means that it's kind of in one area. You know how like you have your local community, that's kind of one area. And then you have things that affect a whole system or they're systemic and that's widespread. So we're going to have local reactions and we're going to have systemic reactions. In the skin, for instance, the local reactions would be, let's say, itching, let's say, hives, maybe a local rash, right? Those are local reactions. What's another type of kind of local reaction that kind of primarily stays in one area? That, okay, let's say, let's change my color here. Let's say in the lungs. All right. So in the lungs, so remember, around the lungs, around the bronchi of the lungs, there are these smooth muscles. These smooth muscles around the bronchi will actually constrict. So we put those together. So if we have constriction of the bronchi, we would call that, that's right, it's going to be called bronchoconstriction. So in the lungs, we're going to have, for instance, bronchoconstriction. Okay. Bronchoconstriction. So basically, what we're saying is the pipes in the airway, they start to get smaller. They bronchoconstrict, they get smaller. And when they bronchoconstrict, imagine if air is trying to pass through there, it's now going through a small opening. So it's going to sound different. Ah, that's right. So when we have that bronchoconstriction, what sound is often heard with that? That's the sound that we know as wheezing, kind of this high pitched noise as air is rushing through a narrowed airway. So, with the bronchoconstriction, we're going to have, for instance, that sound called wheezing. Okay. Now, I'm laying the foundation because the next thing you're going to see me do after I go through the whole steps is I'm going to tie in all the different medications and show you how everything works. Okay. So far, let's just recap what we said so far. So far, we said that Uh, in fact, let me just pick up on this part and then I'll redo the whole thing in a moment. So, once once the histamines and the leukotrienes get released from these mast cells and basophils that get activated, they're going to cause local reactions. In the skin, it'll cause things like itching, hives, and a rash. In the lungs, it can cause things like bronchoconstriction. Now, now how do you get this itching, the hives, and the rash? That actually comes from very small blood vessels called capillaries, very small blood vessels. And you have this thing called increased vascular permeability. What in the world does that mean? Increased vascular permeability. What is that? Basically, that's just a fancy way of saying the things start leaking out of those capillaries. So instead of everything being contained within the capillary, stuff starts leaking out, right? So you had all these chemicals that are inside that blood in the capillary and it starts leaking out. That's actually what causes the itching, the hives, and the rash. It's increased vascular permeability, or it's stuff leaking out that's not supposed to be leaking out, okay? Or that you don't want to leak out. Now, that's the local reactions. Now, what happens on the systemic? So, if we take an allergic reaction, we have very Mild things that happen. So it can be from very mild to very severe. Okay. If it's very mild, we call it an allergic reaction. If it's very severe, we call that anaphylaxis or anaphylactic shock. Now, let's talk about the severe stuff. So, one of the things that can happen is the blood vessels once that histamine, especially histamine and leukotrienes, get released from those basophils that are found in the blood, it can start to damage the blood. And one of the things it does is it causes vasodilation. That's where the pipes get wider. So that term is going to be vasodilation. Okay, say it with me. Vasodilation. Okay. Now, when the pipes get bigger, what actually happens to the blood pressure? Now, it's not just magic or it's not just some random thing. It actually is just straight physics. It comes from the law, Poisson's law. Let me just write that out. So Poisson's law says that, let me just write the formula first. Pi delta P R to the fourth over 8 N L. All right, let me break all this down. So that's a crazy formula. You may or may not have seen this before. This is actually Poisson's law. I forget how to spell it, but let me break it down. Q stands for flow. Okay, Q stands for flow. Okay, then we have pi. So that's going to be dealing with the circumference. Then this delta P here is change in pressure. And then this R to the fourth, that's going to be the radius. So if remember how if we take a circle and we've got half the diameter, so the half of the diameter is what's called the radius. Okay. So the radius of the pipe, the radius of the blood vessel raised to the fourth power. And then we have this number 8, this letter N, that means viscosity. So that's basically the thickness of the blood. And then this L is for length. Okay, let's break all this down. What we're saying is, what are the factors that affect blood flow? What are the factors that affect flow? So indicated by letter Q. The factors that affect flow, well, the biggest factor is going to be radius. Notice how it's raised to the fourth power. So we could put any number here, but because this radius has a 4 exponent, it's raised to the fourth power, it's going to have a major effect. So one of the biggest factors that determines blood flow is the radius. So the size of the blood vessel. If you have a small blood vessel versus a big, if it's really narrow versus really wide, that's going to greatly affect blood flow. Another thing is the change in blood pressure. As blood pressure gets high, that's going to affect flow, versus when blood pressure gets low, that's going to also affect flow. Now, something else here is viscosity. So because these numbers down here are in the denominator, as these numbers get bigger, flow goes down. So for instance, as viscosity gets bigger, that means that the blood gets thicker, blood flow goes down. So thick blood, slow flow. Or as the blood vessels get longer, it's going to cause more resistance, and more resistance is going to decrease the flow. Now, what are some things that cause what are some things that could cause the blood to get thicker? Well, you take something like polycythemia, where you have all these red blood cells that are being made. It makes your blood thick. Or let's say in the case of diabetes, where you have all this sugar in the blood because you have a problem either with insulin, where your body's not making insulin, or you have a problem with insulin resistance where it's not using the insulin well. In either case, the blood sugar can get just higher and higher and higher. And when you put all that sugar in the blood is going to start to get thicker. So now, what are some things that could make the blood vessel longer? Well, think about it. Let's say somebody is obese. So their body was this size, and then now their body is this size. Well, because their body has gotten bigger, your body has to make more blood vessels. What's the word for that? That word is called angiogenesis, where your body makes more blood vessels. So when you get bigger, your body has to make more blood vessels, but also the vessels that are there tend to get a little longer. So with obesity, that can cause your blood vessels to get longer. What's that going to do to your blood flow? It's going to start to go down. Okay. So I want you to know this Poisson's law, because this explains a whole lot of stuff that goes on in the body. Okay. And don't worry about taking notes right now. I want you to just pay attention to me so that you get the story down. You're going to be able to watch this on video. You can play it back over and over and over. Share it with your friends. So if you know somebody that they're learning medicine and perhaps they could use a better understanding so they don't just stay at level 1 and level 2 knowledge, at least they want to get up to level 3 and level 4, share this video so they can also have access to this information. So let's keep going. So where were we in the story? We were talking about, and I promise I'm going to go back over all of this, but we were talking about in the setting of an allergic reaction. One of the things is when you have a systemic, one of the systemic effects is that your blood vessels widen, they dilate. And we know from Poisson's law that radius greatly determines blood flow. So as this blood vessel gets wider, what's going to happen to the pressure though? Well, eventually what's going to happen is the blood pressure is going to actually decrease. The blood pressure, in order for flow to stay the same, the blood pressure will actually decrease. Now, there's one magic number that we want to know, okay? There's a number at which the pressure needs to stay above in order to have enough pressure to send blood everywhere it needs to go. That magic number is 65 millimeters of mercury, okay? Below 65 millimeters of mercury, your body goes into a state of shock. So that's actually what happens in anaphylactic shock. Your blood vessels start leaking out. The blood vessels also dilate, they get bigger. Your blood pressure goes down. It gets down to this magic number below 65 millimeters of mercury. And now you're in a state of shock. So, for instance, if you were to take a normal blood pressure where the top number is about 120, okay, here is 65. We want our normal blood pressure to be up here somewhere. However, in shock, your blood pressure gets way down, dangerously low. What happens in a state of shock? Well, first of all, what is shock? Let's use level 1 knowledge, the what. What is shock? So, by definition, shock is also known as hypo or low perfusion. Okay. Perfusion means that you're getting all the nutrients and you have enough flow to get all the nutrients to where it needs to go, to all the tissues. So, shock, by definition, is called hypoperfusion. Another way to say that is inadequate perfusion. Okay. You don't have enough pressure to get blood everywhere it needs to go. Now, when you don't have enough pressure to get blood everywhere it needs to go, why is that a problem? Well, because in the blood, what's in there? In the blood, there's oxygen, there's nutrients. For instance, there's glucose, and different cell types need certain nutrients to stay alive. So, when you don't have enough pressure to send those nutrients where they have to go, here's what happens. The next thing that happens is the cells start to die. Okay. And then when the cells die, the organs die. And then when the organs die, eventually the whole organism dies. Okay. So that is exactly what happens in an allergic reaction. Now, let's go back over that and then we're going to build the story from there. You with me? Stay with me. So, we're talking about an allergic reaction. The mild form is an allergic reaction. The more severe form is anaphylaxis that can progress to anaphylactic shock. How does it happen? You get exposed to some type of allergen, peanuts, shellfish, eggs, and so forth, right? You get exposed to it. The very first time your body has ever seen it, nothing happens because you don't actually have all the players on the team to cause things to happen yet, okay? So your body has to get sensitized to whatever that allergen is. Your body has to kind of get used to it so it knows how to react the next time it comes around. So it's ready. Okay. So your body says, hey, B cells, here's what I need you to do. B cells, mayday, mayday, mayday. I need you to start making some antibodies. So the B cells start to make antibodies. Remember, there are 5 types of antibodies. Those antibodies are IgG, IgA, IgM, IgE, and IgD. For instance, IgG, it's the one that crosses the placenta. So it's the one that allows the baby to have some kind of immunity for like the first 6 months of life. So IgG crosses the placenta from the mom to the baby and kind of protects the baby for the first 6 months. But the main one involved in allergic reactions is going to be Ig or immunoglobulin E. That's a type of antibody. Okay. So your body makes some IgE, but we can't just make one IgE. What's that going to do? We need a whole army of IgE. So your body makes more and more and more and more and more IgEs. So those IgEs, then they come together. What's that term for that? When they come together, that's now called cross-linking. And so this set of IgEs that have cross-linked, then they will bind to the mast cells and the basophils. The mast cells are primarily found in the tissue, the basophils are primarily found in the blood. Both of these release different chemicals, for instance, histamine and leukotrienes, that can cause all kinds of effects. But that's what happens in the initial round during the first exposure. That's it. It's just the sensitization phase. The next time you get exposed to something, now we enter the activation phase. During the activation phase, this allergen now binds to all of this other stuff. So once this allergen binds to the cross-linked antibodies that are bound to the basophils and mast cells, it's going to start, for instance, damaging capillaries. When those capillaries now get damaged, it's going to start leaking out. What's the term for that? What's the term for those capillaries starting to leak out? That's increased vascular permeability. Okay. When those capillaries start to leak, they can cause local reactions, for instance, in the tissues, and they can cause things like itching, hives, and a rash of the skin. So we have increased vascular permeability. We can have a somewhat localized reaction in the lungs, and that's where we start to constrict the smooth muscles around the bronchi of the lungs, and that causes bronchoconstriction. And remember, that's what produces that sound called wheezing. But for instance, one thing I didn't mention, but let's mention it now. We can also travel to let's say, the gut. Excuse this drawing. But anyway, we're going to say the gut. And in the gut, we can have things like nausea, vomiting, diarrhea, abdominal pain, all associated with an allergic reaction. Okay. Now we can even have more severe, more systemic effects. So let's say when we go to the blood vessels, we can actually cause massive vasodilation of the blood vessels. So the pipes get really big. And when the pipes get really big, based on this physics principle, you don't have to remember that, but by knowing this, you can figure out a lot of things that happen with blood vessels and all of that, and blood flow. But when the pipes get bigger, it causes a massive drop in the blood pressure. Blood pressure goes way down. Specifically, it goes below this threshold here of 65 millimeters of mercury. At that point, we're now in a state of shock. We define shock as where you don't have enough blood flow to send nutrients everywhere it needs to go. So you have, the word for that is hypoperfusion or inadequate perfusion. And then now what's going to happen is, because the cells can't get nutrients, the cells start to die. And because organs are made up of, well, tissues are made up of cells and organs are made up of tissues, eventually what's going to happen is the organs start to die. And when enough organs die, the systems die. When the systems die, the whole organism dies. Thus, you die. Okay? That's the how and why of allergic reactions. Now, let's now tie in the different drugs, the different medications. So one of the things that's going to happen is, when this reaction occurs, we're going to have widespread inflammation. Okay? We're going to have widespread inflammation. Now, I'm going to come back to that, but let me explain that a moment. So when it comes to inflammation, so let's say the cells we have this inflammation that starts to happen. Okay? After then, what's going to happen is, eventually we're not going to have enough blood flow. So we're going to call that ischemia. That's going to lead to cells becoming injured. Eventually, now up to this point, this is all reversible. We can do something about it if we act quickly enough. But after then, what's going to happen is it's going to progress to something called infarction. That's where now tissues are really starting to die. And then after infarction, it's going to progress to something called necrosis. Now, this is where we have irreversible damage. So we have like permanent death of cells. And then that all that necrosis is going to lead to permanent death of the whole body. Okay? So whenever things get injured, whenever cells get injured, one of the first things that starts to happen is inflammation. So, in an allergic reaction, we're going to have a lot of inflammation. Okay. In an allergic reaction, we're going to have a lot of inflammation. How do we counteract some of that? Well, for instance, at this step, at the inflammation step that happens right here, we can stop that with steroids. So, you'll notice that in allergic reactions, one of the things we do is steroids. Now, what's the name of a steroid that we often use? That drug is, you'll often hear it pronounced as solumedrol, also known as methylprednisolone. Okay, that's a corticosteroid. It's a steroid, and its job is to help with the inflammation. And now, in a moment, I'm going to go a step further, and I'm going to even show you how steroids actually work. Right now, let me just show you kind of where they work in this whole process. So, the reason we're using steroids or solumedrol in an allergic reaction is because we're trying to stop some of this inflammation that happens. Now, remember how we also had Okay. Remember how we also had this itching and this hives and this rash that started to happen? And what was the chemical that caused that? Remember, we had those chemicals, histamines and leukotrienes, right? Well, what do you think? What kind of drug could I use to counteract a histamine? Maybe a antihistamine? Yeah, that sounds good. So here, let me free up some space for a second. Well, here, let's just write it here. So, one thing that you could use to counteract histamines would be an antihistamine. Do you know of a drug that's an antihistamine? I bet you do. That drug is Benadryl, also known as diphenhydramine. Here, let me go to some space here. So, when we have all this histamine release, to counteract that, we can use an antihistamine. That antihistamine, the trade name is going to be Benadryl. What's a trade name? A trade name is by a company that they market the drug under. So, for instance, they're going to charge a big money for this medication called Benadryl. That's the trade name. However, the generic name for that is going to be diphenhydramine. Okay? So the trade name for this antihistamine is Benadryl, and then we also have the generic name as diphenhydramine. That's an antihistamine. Now, for instance, let's go back to this. So remember, we have histamines that get released. We can counteract that with an antihistamine, Benadryl or diphenhydramine. That's why we give Benadryl for allergic reactions. It's because of the histamine release. We can also use, so if we're going to have all this leukotrienes that get released, how would we counteract that? Well, remember how when we have histamines that get released causing problems, we can counteract it with an antihistamine. Well, if we have leukotrienes that get released, how could you counteract that? Well, that could be an anti-leukotriene, or what we would specifically call a leukotriene inhibitor. Okay, drugs like montelukast. Okay, those are leukotriene inhibitors. Now, what else did we have though? For instance, remember how we had this bronchoconstriction that was causing this wheezing? Okay, so, for instance, on these bronchi, we have what are known as beta 2 receptors. The way I remember this is you have two lungs, so beta 2 affects the lungs. Like beta 1, you have one heart, so beta 1 primarily affects the heart, and beta 2 primarily affects the lungs. So we could actually use a beta 2 agonist. So what beta 2 does is beta 2 comes in, this beta 2 comes in and reverses this bronchoconstriction. Okay, so we could use a beta 2 agonist, and that's going to be a drug like albuterol. Okay, or we can use something like a duoneb that actually has two medications. So it's going to be albuterol plus ipratropium bromide. Okay, so it's two medications that worked as a short acting beta agonist. Okay, that's going to bronchodilate. So far in an allergic reaction, we have now explained why we use steroids. We've also explained why we use antihistamines like Benadryl, also known as diphenhydramine. We also explained why are we using things like beta 2 agonists like albuterol or duoneb with albuterol and ipratropium bromide, because we're trying to counteract the effects of the bronchoconstriction and actually cause bronchodilation. Because when we dilate the bronchi, we make those bigger, and now we can get more air in. And when more air comes in, it's now easier to breathe. Does all that make sense? Look how much we're learning so far by just taking one concept and showing you how to apply it a lot of different ways. Guys, already we're talking about the immune system, we're talking about different cells of the immune system, we're talking about blood vessels and the physics of it. We've already gone in the skin and the lungs, we're in the blood vessels. I mean, look how much stuff we're covering literally in one lesson by me showing you one concept. Okay? And let's keep going. I just thought of something. I just saw something. So now, remember how we had all this vasodilation? That's where the pipes got really bigger and the blood pressure dropped. Well, obviously, we don't want the blood pressure to just stay low. So, what could we use to counteract the effects of the vasodilation? Well, let's think about it. If vasodilation is where the pipes get bigger and the blood pressure drops, is there any way that I could make the pipes get smaller in radius? I could constrict those blood vessels and hopefully get the pressure up. Yes, there is a way. Okay, I think we could use something like, what if we use something like like epinephrine? Okay, we could use epinephrine, right? This is why we use an EpiPen and we give that intramuscular injection in the thigh, for instance, with an EpiPen. Or let's say if you're a healthcare provider, you can actually draw up some Epi for, remember, that's going to be Epi 1 to 1,000, because that epi activates different receptors. So we have alpha 1 primarily. We also have some beta 1. We're going to activate different receptors, and now we're going to counteract this vasodilation by causing vasoconstriction. So we're going to make the blood vessel tighter. And what's that going to do? Oh, you didn't see what I was just doing. So let me go back. We're going to use epi, specifically epi 1 to 1,000, and we're going to counteract this vasodilation by causing vasoconstriction. We're going to make the blood vessel tighter, and what's going to happen to the blood pressure? It's actually going to start to go up. Now, what's another way that we're going to try to get this blood pressure up? Well, we're going to give fluids. Okay? Remember, they're in a state of shock. So we're going to start by giving them some fluids, some IV fluids. Now, let's say we gave them the epi to help with this. It's also going to help with this breathing. It's also going to help with the blood vessel. We're going to give them fluids to try to get the pressure up. But what if the pressure doesn't go up enough? Now we're going to come in with a stronger drug, a stronger pressor, and that could be, for instance, norepi. So norepinephrine, okay? Also known as Levophed. Okay, so check this out. So now, instead of just knowing what an allergic reaction is or what do the protocols say do about it, because think about it, I could teach a monkey to just memorize stuff, right? Or I could teach a bird to just parrot information. What is an allergic reaction? An allergic reaction is where your body overacts the immune response, right? A bird could say that. Or I could say, all right, bird, tell me, what do we do for allergic reactions? The protocols say we give epi, solumedrol, a duoneb, Benadryl, right? Anybody could repeat that, but I want you to understand how it works, why it works. Why are we doing this stuff? Okay. So now we've already gotten up to level 3 knowledge. How about this? Anybody learning something so far? You learning? Now I want to show you. So far we talked about steroids, and I wanted to come back to that because I want to show you. I just told you that the steroids are going to help with some of this inflammation. let me actually show you how steroids work. Are you ready? Is this fun? Now, steroids. Everybody take a deep breath, let it out, and let's go. So, steroids. Okay. And remember, you don't have to take any notes right now. You've got the video, so you're going to be able to play this over and over and over. And you're going to share it with your friends, and you're also going to drop a comment to let me know what are you learning so far. So there are 5 actions of steroids. How many actions? That's right. There are 5 actions of steroids. And the way I remember this actually came from my mentor, Dr. Francis. You've probably heard me talk a lot about him. He's like my bonus dad. Dr. Francis taught me to go back and learn normal for myself. He said, don't just memorize something you heard out of some book, read out of some book, or heard some professor say. Learn this stuff for yourself and really learn normal. So shout out to Dr. Francis. Dr. Francis taught me there are 5 actions of steroids, and he used the mnemonic I-KISS. Okay. So the I stands for it inhibits an enzyme called phospholipase A2. Just stay with me. I'm just going to tell you what the actions are, and then we're going to break it down a little more, okay? Steroids inhibit phospholipase A2. They also kill T cells. That's one of your immune cells that causes inflammation. So they kill T cells. They also kill this other type of white blood cell called eosinophils, which is also involved in inflammation. Okay. The other thing they do is they inhibit something called macrophage migration. All right. What does that even mean? So whenever a blood vessel gets injured, right, we got to send some different resources on the scene. So we gotta send out the alarm, sound the alarm, and send the troops out. Well, one of those troops that has to migrate to the area is macrophages. Okay, macrophages are one of the first cells that show up in inflammation. The very first cell that shows up is neutrophils. Neutrophils show up in about 4.5 hours. Neutrophils release an enzyme called NADPH oxidase, and it causes free radical damage. But it happens in about 4.5 hours. This is where that 4.5 hours comes from when you have a stroke patient, right? You have a patient who's having a stroke, and we say, hey, you need to get to a PCI capable facility within about 4.5 hours. It's because in 4.5 hours, the neutrophils show up and they're going to cause all this free radical damage. So that's where that time comes from. After neutrophils show up, then macrophages show up, okay? And they're going to show up in about day 1, 24 hours after injury, up to about day 4. So days 1 to day 4, macrophages show up. Steroids are going to inhibit that, and they're going to help slow down that inflammation. Another action of steroids is they are going to stabilize the endothelial cells, okay? They're going to stabilize the endothelium. The endothelium are those cells that are at the base of the blood vessel. Remember how one of the things that happens is we have that vascular permeability where stuff starts leaking out of the blood vessel. Well, what we're trying to do is kind of shore this up, stabilize these endothelial cells to stop things from leaking out. And then the other thing they're going to do is they're going to stabilize the mast cell. Remember how let's go back. Remember how this mast cell right here starts releasing these chemicals. It releases like histamine, it releases leukotriene, and that causes all kind of problems, right? Well, that's going to happen later. That's going to be more so the delayed reaction that happens in anaphylaxis or in an allergic reaction. So we give steroids to counteract some of these delayed reactions. Let's go back over that. Steroids have 5 actions, okay? One of them is they're going to inhibit phospholipase A2. That's going to come up in just a minute. They inhibit phospholipase A2. They kill T cells and eosinophils. Hold on, I need a drink. Okay, so they're going to kill T cells and eosinophils. They're going to inhibit macrophage migration. Remember, those macrophages are part of the immune cells that show up generally day 1 to day 4 after an injury. They're going to stabilize the endothelium to prevent some of that vascular permeability, prevent stuff from just leaking out. And then they're going to stabilize the mast cell. And remember, the mast cells contain the histamine and the leukotrienes that cause all these other reactions, and we're trying to stop some of that. So that's why we give steroids like solumedrol, also known as methylprednisolone. Now, in order to understand how steroids really do this stuff, remember I said this, it inhibits this phospholipase A2. What in the world is phospholipase A2? Well, to understand that, you need to understand something called this is a lot, huh? See, if you just know level 1 and level 2, you don't know much, right? You just know like stuff anybody could memorize. You really want to understand it. So, in order to understand steroids, we need to really understand something called the prostaglandin synthesis pathway. Okay? Now, what is this? Let's break it down. We don't want to just use words that we've never heard of before. So, what is a prostaglandin? So, prostaglandin, they're basically chemicals that are involved in like inflammation, and they cause other reactions. Okay, let me just show you what the pathway is. So the very first thing that happens is we take the cell membrane. Okay, the cell membrane is made up of what's called phospholipids. So that's phosphates and lipids, so fats. So basically, we're going to say fatty acids. Okay, they're going to be fatty acids contained in the cell membrane. And we're going to take some of those fatty acids and we're going to make this substance called arachidonic acid. Say it with me, arachidonic acid. And I may not have that spelled right, but arachidonic acid. Okay. Then the next thing we're going to have to make is we're going to make something called prostaglandin G2. Okay. The next thing we're going to make is something called prostaglandin H2. We're also going to make a prostaglandin I2, and then we're going to make this thing called prostacyclins. Okay. That's kind of the overall process. But in order to make each one of these steps, we need some other ingredients to get us to the next step. Okay. So to go from the fatty acids in the cell membrane to arachidonic acid, we need an enzyme for that. And that enzyme is going to be called phospholipase A2. Remember this enzyme? Phospholipase A2 is the enzyme needed to get us to the next step in the process. Okay? And then to get us to this, so let's put some arrows here. To go from fatty acids to arachidonic acid, we need phospholipase A2. To go from arachidonic acid to prostaglandin G2, PGG2, we need an enzyme called COX. Okay, it actually stands for cyclooxygenase. And then COX comes in two different flavors. There's a COX-1 and a COX-2. Now, to get us from PGG2 to PGH2, we need another enzyme, and that enzyme is going to be called POX, also known as peroxidase. Okay. Now, what do these things do? Well, if phospholipase A2 comes on the scene, it allows us to get to this step, and then we're going to use another enzyme to get to this step, another enzyme to get to this step. But what happens if we keep doing all this stuff? Well, for instance, if we make it to this step of COX, this is what we're going to cause. We're going to create problems like pain, fever, inflammation. Okay. Now, if we make it to, let's say we make it to this step and we make us some PGH2. Now, for instance, we're going to cause things like, we're actually going to make something called TXA2, thromboxane A2, and that's going to lead to things like clots. Now, right now, I'm just going to say clots, but I'll do a separate video on the entire clotting cascade, but just for the interest of time, I'm just going to loosely call it clots. So look at all the stuff that can happen. In fact, let's put that in red. Let's put clots in red. So clots. Okay. So if we allow this pathway to get activated, we're going to cause pain in the body, fever, inflammation, blood clots, right? So we're going to use medicines at different stages to stop some of this stuff. Well, the one that stops this phospholipase A2 is steroids. Okay. Remember how I said that steroids inhibit phospholipase A2? That's this step right here. Steroids inhibit phospholipase A2. Steroids work very high in the process to prevent all this other stuff from happening. So hopefully we don't have as much pain, fever, inflammation, blood clots. Okay. But what if we don't give a steroid and, for instance, we make it to this step? Well, now we're going to have pain, fever, inflammation. Well, what kind of medications could work here? Aha, glad you asked. Well, for instance, what could inhibit COX? One of the things that inhibits COX is aspirin. This is why we give aspirin for pain, for fever, for inflammation. What? Okay. Now, how does aspirin work? You want to know this. Aspirin irreversibly binds to COX-1 and COX-2 and prevents a lot of this stuff from happening. Okay? Aspirin irreversibly binds to COX-1 and COX-2. That's why we give aspirin for pain, for fever, for inflammation, and we also give it for clots. In fact, those are the 4 actions of aspirin. Here, let's go ahead and, so remember I just said pain, fever, inflammation, and clots. So here, let's go ahead and write that in. So aspirin. Aspirin, also abbreviated ASA. ASA, that stands for acetyl salicylic acid. Okay, let's say it. Let's say it. Acetyl salicylic acid. So aspirin, also known as acetylsalicylic acid, has 4 actions. We just talked about that. What are the 4 actions of aspirin? This is why we give aspirin. One of them is it's anti-pain. So the word for that is analgesic. Okay? Aspirin has an analgesic effect to help lower pain. Aspirin also has what's called an anti-inflammatory effect, and that helps with inflammation. Okay? Aspirin also has an anti-fever effect. That word is antipyretic. Okay? And then it also has, remember, one of the things that happens with this prostaglandin synthesis pathway is we produce clots. What actually happens when this TXA2, thromboxane A2 gets released, it actually causes, for instance, it causes vasoconstriction, and it activates platelets. And platelets, remember, platelets are the part of cells, or it's the part of blood that actually causes clots. So when a whole bunch of platelets come together, when a whole bunch of platelets stick together, that word is aggregate. When platelets aggregate or clump up, it causes a clot. So an action of aspirin is it's an antiplatelet. Okay. So we give aspirin for analgesic effects for pain. We also give aspirin as an anti-inflammatory to help reduce some of the inflammation that can also lead to more pain. We give it for fever because remember, aspirin works on COX-1 and COX-2, so it has a lot of different actions. And then finally, we're trying to stop those platelets from aggregating together. This is specifically the reason we give aspirin in the setting of, for instance, a heart attack. Okay? In a heart attack, if the patient has no contraindications, meaning they have no reason they can't take it, we give them in an emergency setting, we give them 4 baby aspirin. So that's going to, each baby aspirin is 81 milligrams. And then if we give them 4 of it, that's going to be 324 milligrams. And we give that in a chewable tablet. The reason we give chewable tablets is because, especially like in EMS, we don't have water on an ambulance. So we need them to chew it up. Also, it's going to make it more bioavailable, meaning that the body breaks it down faster so it can work quicker. Okay. So that's why we use it in the setting of a heart attack. It's not going to stop those clots that have already formed, but it's going to hopefully prevent more clots from forming so that we have more blood flow. Okay. What's the word for a heart attack? Our medical term for that is, of course, a myocardial infarction. Okay? Myo, let's break it down. Myo means muscle. Cardia means heart. So we're talking about heart muscle, so the heart. And infarction, remember going back? Let's go back to that. Infarction is the step where we've already had inflammation, we've had ischemia, the cells have become injured, and now they infarct. Okay. Now they're getting close to the point of getting, if we don't do something now, we're going to have permanent, irreversible death. That's why we say that time is muscle in a heart attack. And that's why it's so important that they get to the cath lab quickly. See, we were talking about allergic reactions, but look how we're applying that in the setting of a heart attack. Okay. So now let's go back to this part right here. Another drug that works on COX, remember, aspirin irreversibly binds to COX-1 and COX-2. Let's just put that in. So aspirin irreversibly binds to COX-1 and COX-2. But there are certain medications that primarily work on either COX-1 or COX-2. Those are going to be drugs like Advil, Motrin, ibuprofen, okay? So that's why we don't necessarily give those for clots. Okay. Now, there's this other one. Remember how if we make it to this step, it's going to keep going and it's going to go to this step if this enzyme is present. But in order to get us to this step, we need this other enzyme. Okay. This other enzyme, if POX gets activated, it's going to cause things like pain and it's going to cause fever. Is there a drug that we could use to counteract POX or counteract peroxidase? Yes, that drug is called Tylenol. Okay. Tylenol, also known as acetaminophen, outside of the US, also known as paracetamol. So Tylenol, acetaminophen, paracetamol, those actually inhibit the enzyme POX. That's why we give Tylenol, for instance, for pain. That's why we give Tylenol for fever, but we don't necessarily give Tylenol much for inflammation because it's a different enzyme that causes a different effect. Does that make sense? Look how much we've learned just today. Okay. And yeah, we'll just stop there. I mean, there's more that I can go into, but just in the interest of time, we're going to stop there. Let's just kind of review everything we talked about today. We started talking about an allergic reaction, how there's a mild form and a severe form. The mild form is the allergic reaction. The severe form is anaphylaxis. Now, what happens is during the sensitization phase, the first time your body gets exposed to something, it says, hey, troops, we got to get ready. Because I don't know what this is. This bad guy, I don't like him. We got to get ready to knock him out if he comes back around. He caught us the first time off guard, but he's not going to catch us again. So you get exposed to an allergen. Your body says, all right, B cells, I need you to start making antibodies. The one I want you to really make is some IgE. It's the one involved primarily in allergic reactions. But don't just make one, make a whole lot of IgEs. And then IgEs, I need you all to come together, act like you like each other, and then cross-link, okay? When you all come together, I want you to go over to the basophils, go over to the mast cells and bind to them, stick close to them, hang out with them. Okay. And that's what happens during the sensitization phase. Then the next time your body gets exposed to it, that allergen, so first, this allergen is not there. But then that allergen comes over and travels to that area. And then when that touches everything else that's there, it's going to cause these basophils and mast cells to start releasing substances like histamine and leukotriene. The histamine or the leukotriene can cause a localized reaction in the skin that's going to produce itching, hives, rash. In the lungs, it's going to produce bronchoconstriction. In the GI tract, it's going to cause nausea, vomiting, diarrhea, abdominal pain. More systemically or more severely, for instance, it can go to the blood vessels, cause massive vasodilation. Now the blood pressure drops. It gets dangerously low. It creates a state of shock. Shock is known as hypo or inadequate perfusion. And when that happens, the cells are going to die, the organs are going to die, and the person's going to die. How do we counteract all of that? Well, we can use steroids here to help with some of the inflammation. We can use antihistamines to help with the histamine release. We can use leukotrienes to help with the leukotriene release. As far as the uh, blood pressure, we can use epi. For instance, epi 1 to 1000. It's going to help with the breathing. It's also going to help with the blood pressure. Hopefully, it's going to raise the blood pressure. If that doesn't work, we're also going to use fluids to get the pressure up. And if we need more, a stronger medication, we'll use pressors like norepi or levophed. Okay. Now, I told you about the 5 actions of steroids. Steroids inhibit phospholipase A2. They kill T cells and eosinophils. They inhibit macrophage migration, stabilize the endothelium, and stabilize the mast cells. We went over the prostaglandin synthesis pathway. Okay, remember that's where we're going to start with the fatty acids from those phospholipids of the cell membrane. We're going to make something called arachidonic acid. The enzyme needed for that is phospholipase A2. Phospholipase A2, if we can counteract it at this step with steroids, that's going to be your solumedrol, your methylprednisolone. If we make it to this step, PGG2, the enzyme we need for that is COX, cyclooxygenase. COX comes in 2 flavors, COX-1 and COX-2. There's a drug that binds to both of them, that's aspirin. Because COX, when it gets activated, it causes pain, fever, inflammation. It can also lead to blood clots. Okay? The drugs that bind to either COX-1 or COX-2 is going to be drugs like ibuprofen, Advil, Motrin, things like that. Now, if we make it to this step and we create prostaglandin H2, the enzyme we need for that is POX or peroxidase. Peroxidase causes pain and fever. The drug that counteracts that step is Tylenol, also known as acetaminophen, also known as paracetamol. If we keep going down this pathway, we're going to make things like thromboxane A2. That's going to cause vasoconstriction. It's going to activate and aggregate those platelets. That's going to lead to clots. Okay. Remember, I said there are 4 actions of aspirin. Aspirin is also known as acetylsalicylic acid. It has 4 actions. Remember, it irreversibly binds to COX-1 and COX-2. Those actions are analgesia for pain control, anti-inflammatory to stop some of the swelling, antipyretic to help with the fever, and antiplatelet to prevent the platelets from clumping together. So I hope that all made sense. Now, what I want you to do is give me a comment. Let me know what you learned today. Hope you learned a lot. And on to the next one. The next video is diabetes.